Today I am going to tell you about a worse disease which is leading most of human to death. More than 1 million Americans have heart attacks each year. It happens every 40 seconds to someone in the USA according to CDC. And yes, all over the world also. How to recognize the signs of a heart attack and what to do? It is important to recognize the signs of a heart attack, which can vary by person. Sometimes a person may have a heart attack without realizing it, and not seek the emergency medical care they need. That could lead to lasting heart damage. The medical name for a heart attack is a myocardial infarction, MI. A heart attack happens when there is a loss of blood supply to part of the heart muscle, often due to a blockage in a nearby artery. Symptoms include pain in the chest. It is a medical emergency that needs hospital treatment. A person who is experiencing a heart attack or myocardial infarction will feel pain in their chest and other parts of their body, as well as other symptoms. Spotting the early signs of a heart attack and getting prompt treatment is crucial and can save a person's life, as heart attacks can be fatal. It is crucial to recognize the warnings as soon as possible and contact emergency services. Symptoms include a feeling of pressure, tightness, pain, squeezing, or aching in the chest, pain that spreads to the arms, neck, jaw, or back, a feeling of crushing or heaviness in the chest, a feeling similar to heartburn or indigestion, nausea and sometimes vomiting, feeling clammy and sweaty, shortness of breath, feeling lightheaded or dizzy. In some cases, anxiety that can feel similar to a panic attack, coughing or wheezing, if fluid builds up in the lungs. The following may also develop: hypoxemia, this involves low levels of oxygen in the blood; pulmonary edema, this involves fluid accumulating in and around the lungs; cardiogenic shock, this involves blood pressure dropping suddenly because the heart cannot supply enough blood for the rest of the body to work adequately. Heart attack causes: your heart muscle needs a constant supply of oxygen-rich blood. Your coronary arteries give your heart this critical blood supply. If you have coronary artery disease, those arteries become narrow, and blood can't flow as well as it should. When your blood supply is blocked, you have a heart attack. Fat, calcium, proteins, and inflammatory cells build up in your arteries to form plaques. These plaque deposits are hard on the outside and soft and mushy on the inside. When the plaque is hard, the outer shell cracks. This is called a rupture. Platelets, disc-shaped things in your blood that help it clot, come to the area, and blood clots form around the plaque. If a blood clot blocks your artery, your heart muscle becomes starved for oxygen. The muscle cells soon die, causing permanent damage. Risk factor: some people may be more vulnerable to heart attacks. Common risk factors include high blood pressure, obesity or being overweight, a poor diet, particularly one high in trans or saturated fats, low levels of physical activity, smoking tobacco, older age, diabetes or high blood sugar levels, a family history of heart disease. Prevention: a person can lower their risk of having a heart attack by doing at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week. Reducing stress, not smoking, eating a diet rich in vegetables, fruits, whole grains, legumes, nuts, and oily fish, maintaining a healthy weight,